Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today my topic of discussion is about cicatricial ectropion and its possible complication, that is corneal epithelial defect. This is the corneal photographs, slit lamp photographs of one of my patients who presented to my OPD with generalized skin lesions, and he also developed cicatricial ectropion in both eyes. And due to this cicatricial ectropion, you can see the outward turning of the eyelids, conjunctival congestion, and there is central epithelial defect in the left eye with mild discharge. These are other slit lamp photographs. You can see there is mild, even bulbar conjunctival congestion, along with the eyelids hyperemia, outward turning of the eyelids, and the discharge in the both photographs in fact. And as I mentioned earlier, in the left eye, which is shown over here, it is taking up stain, but there were no signs of infection, there were no stromal infiltrates, no anterior chamber reaction, and it was a non-infective, in fact, corneal epithelial defect with no signs of infection. These are the two other photographs. Here in the one of them you can see that there is some mucus discharge. This was not purulent discharge. Yes, this was mucus discharge, mucus strands which were there in the eyes, and the eye was thoroughly cleaned, and all the debris were removed from the eyes. Yes, and you can see how much it is inflamed. This is both eyes. Eyelid margins were inflamed, and the eyelids, you can see they are in fact retracted outwards, pulled over there, and he is unable to close both of his eyes. Here you can see that in spite of his full efforts, he cannot completely close his eyes. These eyes remain open. When these eyes are open and the cornea is exposed to atmosphere and not properly closed by the eyelid margins, no more protection from the eyelids, not a good distribution of the tear film. So this way this patient has developed corneal epithelial defect, and there are some discharge over there which has mucus. So this is shown that in spite of his full efforts, he cannot close his eyes properly. Some other views, same picture, inflamed lid margins, everted, unable to close both eyelids. Yes, and mild conjunctival congestion. These are the photographs which were taken without any force being applied to open the eyelids. This is the natural position, and this is how the eyelids and how much they are covering. Just partially covering, and they are retracted. If you please concentrate on one of the photographs, you see even the center of the eyelid, lower eyelid, is being retracted downwards, and even the bulbar conjunctiva and palpebral, basically the palpebral conjunctiva of the lower eyelids is exposed. Yes, and these are without any being used of the force or any instrument to open the eye. No, these are the natural. What is the natural is location and position of the eyelids. Apart from the cicatricial ectropion, just to mention, these are the fundus photographs of the same patient. You can see the retinal degeneration both eyes, and he has got laser barrage, most likely for the peripheral strengthening because of the myopic changes or any peripheral lesion. So he also had the laser barrage in the periphery in the both eyes, and he had some central degenerative changes in the retina. Basically, in cicatricial ectropion, there is a shortening of the anterior lamellae, and lids margins are pulled away from the eyelids. There are many causes for this. We can say trauma, burns, chemical injuries, skin lesions, ecchymosis, psoriasis, some medications like torzolamide drops like this, brimonidine medications, allergies, these things can cause. But usually the severe form of cicatricial ectropion we see in cases of traumas, burns, especially any chemical injuries. And this patient, as I am telling you, had only also the body skin lesions which are to be decided, most likely psoriasis, like this. So these patients also develop. So what happens that when these lid margins are everted outwards, these patients are prone to develop exposure keratopathy. These patients cannot close their eyes properly, they remain open, the tear film is no more evenly distributed, and above all, the lacrimal system, the punctum, the lower punctum especially, which is draining the most part of the tear film, gets malpositioned, come out of the way. So that system is also affected, and the patients come to us with persistent tearing. The tearing is because of the CEDs, exposure keratopathies, non-closure of the eyelids, and also because of the lacrimal system. The pump mechanism hole is disturbed now. The punctum, which are supposed to be at proper place, the canaliculi cannot drain more longer over there properly. So these things can happen. This is basically because of the shortening of the anterior lamellae and the pull on the lid margins that evert them. When we do examine such patients, we have to examine thoroughly the lid margins. Of course, naturally, we have to see the anterior segment, posterior segment. But when we talk particularly from oculoplasty side, we have to concentrate on the lid margins and the positions of the punctum. And this leads us to the grading system. If some part, for example, if the punctum is only displaced or some part of the lid margin is displaced, we can say it grade 1. If the whole lid margin is displaced, not part, this is grade 2. Then there comes the grade 3, in which palpebral conjunctiva is visible. And after that, grade 4, when fornix is also visible. This is the most severe form of cicatricial ectropion. This photograph, which I have shown you, most likely lie in grade 3, because you can see the palpebral conjunctiva, it is exposed. Yes. So this is the grading system. Well, when we talk about the management of such patients, two things are very important. First of all is to prevent the infection over there from the cornea point of view. If there is CED, we have to rule out any infection over there. Yes. And if there is infection, that infection must be treated aggressively. And once the infection settles down over there, these patients need proper hydration, because eyes are open all the time. They need frequent lubricating eye drops. These people need gels frequently. Along with that, any effort should be tried to close the eyelids. Usually when there is CED non-healing over there, surgeons try taping of the eyelids or sometimes partial or central tarsographies. But in such cicatricial ectropion, these patients need more aggressive approach along with the conservative management, that is lubricants, antibiotic drops, antibiotic ointments, and regular follow-up. Yes, because there is CED and eye is exposed, anytime it can develop infection. When we talk from the oculoplasty point of view, there are different maneuvers, different techniques which the oculoplastic surgeon picks according to the case. This may be Z-plasty, S-plasties. Sometimes they go for the partial thickness graft and sometimes full thickness grafts. In partial thickness grafts, they take some part epidermis and some part of the dermis. While when we talk about the full thickness graft, the surgeon takes epidermis, dermis, and some part of the fat. So it is all about the discretion, and an expertise of the oculoplastic, and he can use anything to close and repair this condition. But as I mentioned, this patient is suffering from the skin lesions, skin diseases, so we have to involve the dermatology department also in the management of this case, because it is a generalized disease which is affecting. This is not because of chemical burn, this is not because of any trauma, not because of acid burn, but it's the manifestation of the skin in response to an immunological process going on, and that he's developed contractions not only here but other parts of the body. So this was very interesting case which I wanted to discuss with my respected audience, that we can have such patients in our clinics where patients present. So basically it will be a team approach of cornea and oculoplasty which go side by side and manage such patients. I want to thank you for your attendance and attention. Thank you.